Yes, hospitalist is a growing field. It's been, if I want to give you a very quick short history of hospitalist, hospitalists have started 20 or 21 years ago by UCSF, University of California, San Francisco, and the reason for that was for basically somebody being in the hospital all the time and focusing on the admitted patients in the hospital, as opposed to the traditional model that the doctors would come in the morning to the hospital, see their patients, round on their patients, and then they were going to their offices and they weren't actually in the hospital to see the patient. If any changes happen, if new admission comes, or if the patient situation changed, the nurses would call them and tell them and give them report, and the doctors would give them answer over the phone. So the doctors wouldn't actually be in the hospital. Maybe some of them would come late at night to see the patient one more time if needed, but it wasn't the situation that doctors were there all the time. So there were two problems with that. First of all, as I said, they weren't always here to see and examine the patient if it's necessary. The other reason was that the length of stay was getting very high. So that's why basically hospitalists invented to focus on the inpatient setting, at the same time having a very close communication with the patient's outside doctor or the primary doctor. And this is getting to the point that most of the parts of the country that you go, especially Midwest and Southern states, I worked in South states like Texas, but mostly in South and Midwest, almost all hospitals are running by hospitalists. So the main service is the hospitalist, and almost all the patients coming to the hospital goes to the hospitalist service. I think this is a pattern that is happening in Northeast also, which is a little behind of South and Midwest in that sense, happening in the West Coast and Northeast. Also, that hospitals are getting more common and getting more power in the hospital in terms of carrying more number of patients, and that's why I think it's a growing field. There are some programs that they offer hospitalist fellowship for research, for administrative focus also. If some of the residents are more interested to know about the hospitalist or to do a little more research on that, there's some institute like Mayo Clinic or some other places.